What is a stress fracture for athletes? Imagine feeling a dull ache in your shin or foot that slowly gets worse with each workout. It might seem minor at first, but it could be more serious than you think. Today, we're talking about a common injury that sneaks up on many athletes. It's called a stress fracture. A stress fracture is a tiny crack or severe bruising inside a bone. It happens because repetitive forces from training or activity put more stress on the bone than it can handle. And like a sudden break from a fall or collision, stress fractures develop gradually over time. Athletes who run, jump, or do high-impact sports are most at risk. Sports like running, basketball, gymnastics, and tennis often see these injuries. Bones are living tissues that constantly repair themselves. When you exercise, small damages happen naturally. Normally, rest allows the bone to heal. But if you keep pushing without giving your body time to recover, damage builds up faster than it can repair. This leads to tiny cracks that can grow bigger if ignored. The process can take weeks or even months, depending on how intense your training is and your overall health. Stress fractures usually happen in weight-bearing bones of the lower body. Common sites include the shin bone, foot bones called metatarsals, the fibula, and the pelvis. Runners often get stress fractures in the shin or foot. Gymnasts and basketball players might experience them in the foot or lower leg. Though less common, stress fractures can also occur in the arm or shoulder from repetitive arm motions like throwing or lifting. Symptoms include localized pain that gets worse with activity and eases with rest. You might notice swelling or tenderness over the affected bone. Early on, the pain might be mild and only during exercise. But if you ignore it, the pain can become constant and more intense. Preventing stress fractures involves managing how much and how hard you train. Gradually increasing your activity level helps your bones adapt. Using proper technique and well-fitting shoes reduces impact stress. Cross-training and strength exercises support muscles and bones, making them more resilient. Listening to your body and adjusting your training when you feel pain can stop small issues from turning into fractures. Diagnosis often needs imaging because early stress fractures may not show up on regular X-ray scans. Magnetic resonance imaging, or MRI, is more sensitive and can detect stress reactions early. Treatment mainly involves resting from the activity that causes pain. Rest periods usually last from 6 to 8 weeks, but sometimes longer depending on severity. During recovery, it's important to gradually return to activity and improve your biomechanics to prevent future injuries. In summary, a stress fracture is an overuse injury caused by repetitive stress that exceeds the bone's ability to repair itself. Proper training, early symptom recognition, and rest are key to keeping athletes healthy and back in action quickly.